Hi everybody, it's been 67 days I think since my jaw surgery, which I think it's been like about 10 weeks now, like 9.5, 10 weeks. I haven't made a video in a little while because I haven't really had anything to update on, but I just recently had an orthodontist appointment, and 2 days ago I went and I saw my oral surgeon, so I figured I'd update everybody on what's going on. I went to my orthodontist about, I think, 2 weeks ago, and I just got everything changed on my braces again. I got all the metal wires off that were holding my bracket and wire together, because instead, for the surgery, they put on, instead of like the regular elastics that connect to your brackets, they wired them shut with metal instead, so it wouldn't snap during the surgery. And I also went and I got all my surgical hooks taken off, except for the ones that hold my elastics that are already on the brackets. They had separate surgical hooks that were clamped on to my braces, and I finally got those off. Thank God. They were really annoying. And that's all they did. They changed everything out, and they told me that instead of coming back in 8 weeks, which is what I've done the whole time I've had braces, I'm going to come back every 6 weeks now. I don't really know why, but probably just so they can check on my progress. I'll show you guys a close-up of what they did to my braces, because they put a chain on my bottom teeth, because my teeth started spacing out because of the elastics. So I don't know if you can see it. And I have to wear my elastics all the time still, except for when I'm eating, and the triangle shape on both sides. But they're not annoying or anything like that. They were making my teeth loose before, but that's why they put the chain on my bottom teeth. So yeah, and I went to see my oral surgeon 2 days ago, and he was really impressed with all my healing. All my dissolvable stitches came out a couple weeks ago. So everything's still healing, but there's no like open cuts or anything like that in my mouth anymore. My nose is still out of place. I didn't tell my oral surgeon that though, because if I did, he would have to make an appointment to put me to sleep so he can pop it back into place, but I don't want to do that. So I'm going to wait until my next appointment, and if it's still out of place, then I'll tell him. He told me that now I have no restrictions on my diet. I can eat whatever I want, within reason. Like, I'm not going to go out and buy a steak for dinner, but anything that's like pretty easy to break up when you're eating, I can have. I haven't really tested it. I had some chips, but it was kind of a pain in the butt to try to chew stuff. So I'm kind of still just eating pasta and stuff like that, just because it's the easiest thing to do. I'm trying to think of what else he told me. He told me that I don't need to see him every couple of weeks now. I only have to go see him, I think, every like 2 months or something like that. Anyways, it's not that much, which is good because it's annoying to have all these appointments. I can do a lot now. I'm pretty much back to normal. I even went to Boston, I think 2 weeks ago, for a whole day, and I walked around all day with my friend, and I'm doing better about not getting lightheaded and stuff like that. I just had to like watch myself and sit down every once in a while to make sure I was like doing okay. Pain wise, I'm doing really good. I haven't used any of my pain medicine. The only time that I'm really in pain is after I wake up, because at night I grind my teeth, which I've always done, but obviously after a surgery it's gonna kind of hurt worse. So I just take regular like ibuprofen pain relievers. I haven't used any of my prescription pain reliever. Like I had what did I have? I had hydrocodone and oxycodone, but I haven't used those in a long time. I got a job, which is good. It's fun to work, but I get really tired really easily still, but that's not that bad. I think that's really all I have to update on. I can show you guys how much I open my mouth and like what I look from the sides, like I usually do. I have been getting a lot of questions in my inbox from people, and I try my best to answer all of the questions. So you guys can keep sending them to me because I really don't mind answering anybody's questions. And I just wanted to say really quick good luck to all you guys that are gonna get the surgery or thinking about it. I hope my videos are helping. So yeah, now I'll show you guys how much I can open my mouth and my bite up close and the sides of my face. So this is my bite. It's pretty good. I can smile a lot better now, by the way. My cheeks are less swollen. Oh, that's something else my oral surgeon talked to me about, my swelling. I have only 10 to 15% swelling left. Most of it's in here, he said, which we already knew that was going to happen. And he said, like, my nose is, like, still, like, wider than it's going to, like, end up being once all the swelling's gone. And he said that I still have some swelling right here and then under my eyes and stuff. But it's not that bad. These, I had to take my elastics off. This is how much I can open my mouth without my elastics, which is pretty good, but I don't take them off at all, so I'm kind of starting to, like, hear it from my orthodontist and my dentist and stuff that I need to start taking them off every once in a while and, like, opening and closing my jaw and trying to push it further, but it's hard because it just, you try to open your mouth and it just stops. Like, it doesn't, you can't push it any further. It's not because of pain, it just kind of stops. This is my face from the sides, and the front, obviously. This is my front. And this is the side. And this is my other side. Okay, so if you guys have any more questions, just let me know and I'll answer them, and if it needs, if I need to make a video for any of your questions, I'll try to do that, and I'll either post it or send it to you personally. So yeah, thanks for watching, guys. Bye.